From May 6th, 2016, this is the full witness testimony of Mary Michaels, mother of Paul Michaels, during the Texas Medical Board versus Dr. Stanislaw Burzynski hearings in its entirety, unedited.
Tell us your name, please, ma'am.
Mary Michaels.
Where are you from?
Troy, Michigan.
Why are you here?
I'm here because I want to support Dr. Burzynski and do everything I can do to show the gratitude and the appreciation I have for what he's done for our family and for me and my whole family. He saved my son's life at great expense to his own.
Who is Paul Michaels?
Paul Michaels is my son.
Can we have him stand up, please? Is that him back there?
That's him.
Is he a cancer survivor?
He is.
What type?
He had an optic hypophthalmic glioma astrocytoma.
And when was he diagnosed?
He was diagnosed November 2nd, 1985. He was 4 years old.
And we're going to jump ahead and I'll come back. At some point, was he treated? Can you turn that on? At some point, was he treated by the Burzynski Clinic?
Yes.
From when to when?
From about 1987 to 2000, 2001.
Okay. And when he was first diagnosed, who diagnosed his cancer?
It was diagnosed by Dr. Alexa Kennedy, a neurosurgeon in Detroit.
And what were you told in terms of the severity of that cancer?
She told us that Paul was going to die of that cancer before he reached the age of 10.
And he was how old?
He was 4 at that point.
And what treatment options, Ms. Michaels, were you provided with?
They told us that he could not get chemotherapy because he was little and it would kill him. And they told us that we could get radiation and that we had to told us we should think about it because the radiation had severe side effects. And that
Let me stop you there. What were the side effects of the traditional treatment that you were offered?
The side effects were that it would blind him.
Would?
It would blind him.
He was how old?
4. That it would most likely cause hearing loss. It would lower his IQ.
Stop. What was your understanding, Ms. Michaels, of how that treatment would lower his IQ?
What was my understanding?
Yeah. What would cause the lowering of his IQ?
I just think it does brain damage. That was what I understood, that it damages parts of the brain that don't recover.
Was it radiation?
The radiation.
Okay. And again, where was the tumor?
On both optic nerves. They said it was kind of Y-shaped. It was on each optic nerve and it kind of came down towards the hypothalamus.
And what was your understanding of how big the tumor was?
Well, they would always talk about centimeters and things, but we sent a package of Paul's scans. They used to be in big envelopes, and we sent it to the Mayo Clinic where Dr. Patrick Kelly was doing robotic-assisted brain surgery, and he was like the only guy who did it, so we sent the package there, and he told us that he said no matter what we do, Paul's going to die of the tumor, and he said it was the largest tumor he had ever seen in anyone at any age.
And what physician was this?
Patrick Kelly. He was at the Mayo Clinic then, but he's at a hospital in New York now.
And did you decide to go forward with the traditional treatment?
No.
Why not?
Because I didn't, well, they also told us that there was a good chance it would shorten his lifespan.
Shorten it from even less than 10 years?
From what it was. So there was absolutely no plus side to that. I mean, they put shunts in. Paul had double vision. Once they put the shunts in, the double vision was alleviated and he could see. He was tired. He was not feeling great, but he wasn't blind. He wasn't deaf. He was, we just didn't want to make things worse,
And did you seek an opinion of a doctor at the Cleveland Clinic?
Yes.
And what did that doctor tell you?
The doctor, well, this was after we had seen Dr. Burzynski for some time, and he put the scans up, and he said, you've been misdiagnosed. He said the tumor that they think it is, it can't be because that tumor does not respond to any chemotherapy, to any treatment. So he wanted to do another biopsy, which we first declined because we thought he meant do a craniotomy and rebiopsy, and he said no, he just wanted to go back to the original hospital and get the matter, the piece of tumor that they had. So we okayed that, And he did that, and he wrote us a letter and said, the tumor is exactly what you said it was, and I have never seen results like this, and keep doing what you're doing, because he said, I don't know of anywhere else that you could get results like this.
How many treatments how many physicians did you see, Ms. Michaels, before you saw Dr. Burzynski?
Oh my gosh.
Facilities?
Well, we went to three different hospitals in Detroit, and then there's the medical center in the downtown area, so they're like kind of affiliated with each other. And we would say, okay, we want to talk to somebody else, and they'd give us, like, it would be another hospital, but still in the medical center. But then Mayo Clinic, Cleveland Clinic, and then my husband had a friend who was a neurosurgeon in Colorado, and we were always sending him the scans and the updates, and he was the one who really told us. He said, there's not really anything to be gained by radiation, think about it. And then we talked to our doctor, and she said, well, he's right, there isn't a lot. So
is it fair to say, Ms. Michaels, that you saw a number of different hospitals and a number of different care providers before you went to see Dr. Burzynski?
Yes.
Let me just jump back. When you found out that your 4-year-old son, Michael, was diagnosed with this, Paul, I'm sorry, you're Miss Michaels, that your 4-year-old son, Paul, was diagnosed with a terminal disease, what was your reaction?
It was the most devastating thing you could ever imagine.
How did you find out, Ms. Michaels, about Dr. Burzynski?
I was watching TV one day, and this was after we'd gone to so many doctors and just kept getting the worst news ever. And the Sally Jesse Raphael show came on, and they were talking about cancer, and my hands were wet. I thought, I'm turning this off.
You're speaking quickly, but you're watching TV.
Yeah.
And on the Sally Jesse Raphael show. And what do you hear? What do you
I
see?
heard them talking about a new cancer, an innovative cancer treatment, and I thought, I don't even want to hear this. This is, you have to give your brain a rest from it.
Now stop for a second. When you say you have to give your brain a rest from it, what do you mean by that?
When you get that kind of diagnosis, it's like this crushing weight. You try to get through the day, and it's just like on you all day.
So when you first heard about a cancer treatment on the television, were you going to tune into it, or were you going to turn it off?
Turn it off. I like couldn't deal. I was trying to make dinner. It was like you have to focus on like one thing, and it's just very.
So as you approached the television to turn it off, did something cause you to change your mind?
Yes.
What?
The man sitting on the stage said he had an optic hypothalamic glioma.
And was that the same diagnosis that your son had received?
Yep. So I thought, I better listen to this. So.
Okay. And when you heard that, what did you hear?
I heard that he was given pretty much the same prognosis that Paul was given, and that he went to Dr. Burzynski, and that he didn't have a tumor anymore.
Is that the first time that you'd heard of the Burzynski Clinic?
Yes.
And so what did you do after you heard this person on a television show who had been diagnosed with the same exact disease that your son had been diagnosed with? What did you do?
I started calling the clinic immediately, and it was busy, just busy for hours. So I had a packet made up, that I always had a packet there if I heard of a place to
Stop for a second. Had you this package that you made up, what was in it, Ms. Michael?
Well, like when they did the craniotomy to get the biopsy,
Stop. I think we know, but can you tell us what the craniotomy to get the biopsy entailed?
They cut Paul, the brain surgery, like from here, they called it a lazy C, and cut back here and then flipped out.
They cut into your brain to get a biopsy.
And then they remove, and they intended to debulk the tumor at that time because it was very large. But when the surgeon came out, she said that she could not debulk it. She said I was barely able to safely get a biopsy because it was entwined and very large. And she just said it was pretty much hopeless. She said it's not in a good place. It's not in a good spot.
So back to the packet that you prepared. Had you sent a similar packet to other physicians?
Yes.
How many?
3 or 4 at least, yeah.
And did the physicians, those other physicians that you sent the packet to, respond?
Yes.
And what was their response?
Well, that they would do Dr. Kelly from the Mayo Clinic said that he would try to do something with surgery, but he said, don't think that this is a cure, and it's going to be with significant side effects. And he pretty much said, really, what's the point? But that he would, we could go see him if we wanted, but it was not because he could save Paul's life.
So until you heard of Dr. Burzynski, did you have any hope, Ms. Michaels, that your son would live a full life or a healthy life?
No, I tried to, but every time I had that hope, the doctors dashed it.
So
there was no hope.
you see this show, you send the packet to Dr. Burzynski, you're unable to get through to him on the telephone. So what happens after you send him the packet?
About a week later, we got a phone call, and I don't remember from who, but they said that Paul was a candidate for treatment, but that we didn't have a lot of time to think it over because the tumor was large and there was no room for it to grow. And we knew that.
And what did you do?
We packed our bags and made an appointment and went down as soon as we could.
How long after seeing this on a television show were you able to get in?
I think it was within a month.
And when you first got to the Burzynski Clinic, can you describe generally the professionalism you experienced and the level of care?
The level of care was unlike anything we had seen before, besides being very professional and just very knowing what they were doing. Like, you had that feeling. They were also very caring. They were worried if you had, everybody was traveling there, and they were worried if you had eaten, if you were thirsty, if you, found a place to stay. They were really trying to take care of all aspects of you.
When you first got to the clinic, Ms. Michaels, who did you see?
Dr. Burzynski.
Okay, and what was discussed generally at the first meeting with Dr. Burzynski?
The treatment, Paul's situation. He looked at the scans and he talked about that he had treated that kind of tumor and successfully, which we had not heard for 2 years of looking.
And what was your reaction to receiving the sort of news that he gave you?
We were afraid to even let ourselves feel it. We were so overjoyed to have like this little piece of hope to hang on to. It was wonderful. We were afraid to believe it.
And who was with you at this first meeting?
My husband, my mom, all three of my sons.
You had 3 sons at the time.
Mm-hmm.
Is your husband still alive?
No, my husband passed away.
And how long ago did he pass away?
It'll be 5 years, May 18th.
And at this initial meeting with Dr. Burzynski, were other people from the Burzynski Clinic also with him?
Yes.
And who was with him, if you recall?
Dr. Barbara was there.
Okay.
And she was very kind to Paul. And Dr. Eva, we met her. And
Dr. Eva, what did you come to understand her licensing status was? Did you understand her to be a physician who was licensed in the United States, or a physician?
No, she would.
I asked.
I think
What
the rest
her-
of her licensure status was fine. The rest of that was
Just leave it at what was her.
Your
understanding of what her license is.
What understanding did you come to have of Dr. Eva's licensing status?
Dr. Eva told us that she was a doctor, licensed not in the United States, licensed in Poland, and that she had gone to medical school in Poland, but she was a doctor but not licensed here.
Was it clear to you, Ms. Michaels, that she was not licensed in the United States or in Texas?
Yes.
Did that matter to you?
No.
And for how long did your initial treatment or your initial consultation last with Dr. Burzynski?
The first day, you mean it?
Yes, ma'am.
Oh, it was several hours.
What happened in the next period of time with respect to his treatment? What occurred?
What occurred?
Yes, ma'am.
We went back to Michigan. He had a catheter in his chest, and we would hang a bag of medicine at the very beginning just on a pole, and it was like a gravity drip that would go in.
What was prescribed?
Antineoplastins, AS2-1 and A10.
And do you recall, in a general way, Ms. Michaels' discussions about that drug?
Yes, we asked about the drug.
And were you given answers about the drug?
Yes.
Were potential side effects discussed with you?
Yes.
And what potential side effects were discussed with you?
Any side effects that were discussed were so nominal or minor that we didn't even, it wasn't being blind or being deaf or stunting your growth or anything like that. It was all minor things that were not even likely to happen anyway, not definite things that radiation would have
And can you compare, and I think you have, but compare for us the seriousness of the side effects that were discussed with you concerning anti-neoplaston with the serious the side effects of the other alternative, or actually the traditional medication?
There was absolutely no comparison. Paul really had no side effects when he took anti-neoplastons.
And who at the Burzynski's clinic prescribed the anti-neoplaston?
Dr. Burzynski.
And for how long was your son on treatment from the Burzynski clinic?
10 years.
And what was the end result of the treatment?
Sitting over there, Paul's fine. He went through school with the pump and everything on and never missed a day of school. He was never sick from anti-neoplastons at all. When he missed school because he had a brain tumor was to go to Texas for our visits, and they were always fun. He felt good. He was like one of the other kids, except he had a pump.
Were you charged for the anti-neoplastons themselves?
I do not believe we were. We were charged for medical treatment.
And were the charges that you were charged for, ma'am, fair in your experience?
I believe so. My son's alive.
And did someone at the clinic explain and discuss those charges with you?
Yes.
How long has he been in remission?
Well, since about 2000, so about 16 years, 17 years.
And what's he doing today?
He is a RN BSN and works in the emergency room in Pontiac, which is a very inner city. It's a very rough ER to work in. And he is also a personal trainer, and he personal trains kids with learning disabilities and things like that. They come on a bus, and he personal trains regular people too, but he has a special interest in personal training these kids.
How long have you been in town?
I've been here since Wednesday.
And did you come down here at your expense, or was
Yes.
Why'd you spend your own money to come down here?
Because I would do anything. There's nothing I could ever do to repay Dr. Burzynski and Dr. Barbara for everything that they did for our family. Every day since we met them, our lives changed into hopeful. I mean, we have a really nice family. Even my husband passed away, but we're still very close. And we really love each other, and we enjoy each other's company, and we wouldn't have that without Dr. Burzynski. And he's my hero, and they treat him like a criminal, and it's heartbreaking to see him and his family have to go through this. And that's part of the reason, is because the debt of gratitude I have for Dr. Burzynski. But I think, too, that every day there's somebody in some emergency room somewhere, some doctor's office or hospital, that's getting the diagnosis that Paul got. And I know that hopeless feeling that you have, and it's horrible. I can't describe it. And those people have no hope. We didn't have hope in 1985, but in 2016, there's still no hope. If they don't have Dr. Burzynski, those kids are going to die, and those families will never be the same. He's the only hope for people that get that kind of cancer. And you don't get it because you smoke or you use drugs. You get it when you're 4 years old and didn't do anything.
I'll pass the witness, Your Honor.
Ms. Michaels, my name is Chris Palazzolo. I'm the litigation manager for the Texas Medical Board. If you have any trouble hearing me, let me know. I'm trying to look at you and talk in the microphone and look at my notes. So if I'm not looking at you, I'm not being disrespectful. I'm just making sure I cover everything I need to cover with you, okay?
Okay.
And, you know, I just want to say that obviously, you know, everybody is happy when somebody, you know, survives a diagnosis of a brain tumor. And you understand I have a job to do, and I've got some questions I have to ask you. But everybody is grateful that your son is able to be in the hearing room today.
Thank you.
Ms. Michaels, have some of this hearing has been recorded and played on the internet. Have you watched any of those videos or witnessed any of the testimony that anybody's given in this case?
No, I have not.
And have you followed any of the comments on social media about this trial since it started in November?
No.
And then have you, I know your son is in the room, and he's been in the room this week, and I'm not sure if he was here in November or not, but have you discussed the case with him in any way?
No, not really. like just when lunch is going to be or when they think it'll be over and things like that.
Okay. Not any details of anybody else's testimony?
No.
And you've took an oath before you testified here today. Have you taken an oath and then given testimony before in the past?
Yes.
How many times?
I think it was 3.
And if it's for something personal, not related to Dr. Burzynski, you don't need to share that personal information with us. But those occasions, did it involve Dr. Burzynski?
Yes.
Okay. And you don't have to give me exact times and dates, but what were those venues? Were those court proceedings or test hearings?
I'm not really sure what they were. I know one was in Austin, one was in Houston, and then it was Congress in Washington.
And you may not remember coming to Austin and Houston very well, but I imagine you remember going to Congress.
Yeah, I do. I mean, it was...
Do you know when that was?
Oh, jeez. Well, I know Paul was in middle school, so if he graduated in 99, in the 90s.
And then Austin and Houston, would that have been before then or after then?
I'm not sure.
And would it have been in the last 5 years?
No.
And each of those times, would you have sworn an oath like you did here? Or
I
would it
think
just
I
been
did. I'm pretty sure that I did. Maybe not in the Washington one, because it was at a long table, maybe we didn't there.
Okay. And in each of those occasions, you were there, kind of like you've told us today, that you would go anywhere and do anything for Dr. Burzynski. And those 3 occasions, you were, and I'm not implying that you would say something that wasn't truthful, but anything you believe to be truthful, you would say, go anywhere and say on behalf of Dr. Burzynski. Is that accurate?
Well, on behalf of Dr. Burzynski, yes, but also several of those times they were threatening to take the medicine away from patients that were already on treatment, and Paul still had disease then, and that would have then meant that he would die. So it wasn't just for Dr. Burzynski, that was
It's for your son.
for my son.
And these anti-neoplastins that your son was taking, do you know if they're available from any other source other than Dr. Burzynski in his clinic?
I do not believe they are.
I know I believe you've done some work for the patient care group or patient support group on behalf of Dr. Burzynski. Is that accurate?
I put Paul's story on there, updated it a couple times over the years.
Do you have any sort of responsibility for maintaining that website, or have you ever?
No.
Do you know who does maintain it? Like what individual does?
I think Mary Jo, I don't know if she's in charge of it, but she has something to do with it, because she would be the one who would contact me every 5 or 6 years and say, update, for Paul.
And you were asked if you paid your own way down here to Austin. Have you ever received any sort of compensation from the Dr. Burzynski or his clinic or the BRI or the IRB?
No.
Have you ever received a 1099 from any of them? You know what a
I
1099
don't even know what that
is?
is, but I'm sure I never.
If you'd received it, you'd know what it was, because it's the IRS form, so you probably would. Have you assisted patients who are receiving treatment or who would like to receive treatment and how they can obtain fundraising?
No.
Have you ever been contacted by a patient about how they can get to Dr. Burzynski or how they would raise money to go to Dr. Burzynski?
Not about money, but about people have called and asked about Paul and said they had the same tumor, but never anything about money.
And when those people call to ask about your son, you tell them that you believe, and I assume you do believe, that your son was cured by anti-neoplastins and Dr. Burzynski in his clinic.
Yes.
Okay. And then we've never met today, and I don't believe anyone from the medical board has ever taken your testimony in a deposition or in a hearing before. Is that accurate?
I don't think so.
So I'm kind of asking a few questions, and I thought I heard you describe, and before I get there, let me just ask this. Would it be a fair statement to say that you could divide your life into 2 segments? The segment before you learned your child had a brain tumor and everything that's happened since. Is that a fair statement?
I'd say that's pretty fair.
I mean, finding out your child has a brain tumor is a life-changing experience.
Yes.
And because this happened back in the 1980s, right?
Yes.
And you still have a vivid memory of what you gave us Dr. Kennedy's name and what Dr. Kennedy told you at that time.
Yes.
And was Dr. Kennedy the one who delivered the news to you that this tumor was present?
Actually, it was, I don't know who it was, but it was when in the emergency room of Beaumont Hospital, they gave him they didn't have MRIs and they did a CAT scan, and they came out and said there was a tumor, and then they assigned us to Dr. Kennedy, and I don't even know if we saw her that same day. They admitted Paul, but so it was a man, whoever it was that gave us that news, that was, I don't know who it was.
And prior to that time, did you know anything about brain tumors and what they were called, or what part of the brain they could be found? Did you have any knowledge?
No one in our family had ever had a brain tumor.
And you told us what Dr. Kennedy was telling you at that time about, I think you went over what the diagnosis was and what their treatment recommendations were, and then there was some talk about surgery. Do you recall all of that?
Well, they did a CAT scan because that was what they had then. And then when she tried to do the surgery, she did the surgery, but it was much worse. And she said that we would have to, from there on, get an MRI because CAT scan wasn't showing what the situation actually was that she saw. Is that what you mean, or?
Yes, and you would have gotten. What was the first time you recall that somebody told you what the tumor was called, or what type of tumor your son had?
That would have been like the day after, a couple days after the surgery, when the biopsy report came back. She pretty much told us it's not good. When she came in, they call it the grieving room, actually. It's aptly named. And she came in and we were praying that she was going to say, oh, I got it all, or I removed it, and he's going to be fine. And she just came in shaking her head and said she could barely get the biopsy. And she could tell by looking at it that it wasn't that she knew it was malignant, I guess is what.
Was anything described to you in terms of grading or staging?
Yes, it was a very low-grade tumor.
And you're gonna have. I'm sorry, but you're gonna have to tell me again. I tried to write it down, but exactly what is your recollection today of the type of tumor that it was?
An optic hypothalamic glioma astrocytoma. And then grade 1 or 2, they couldn't really decide. Some doctors thought 1, some thought 2,
Okay.
which is slow.
And
I'm sorry, which is what?
Slow growing, so it had been there a long time.
Thank you.
and who is Dr. Bruce Cohen?
He is a doctor at the Cleveland Clinic. I don't know if he's still there, but he was there at the time when we went there.
And Dr. Cohen is someone who has reviewed your son's medical records?
Yes.
At least, I'm sorry, let me get my whole question out because I'm giving you some context here. At some point in time, Dr. Cohen reviewed all the records that would have been available as of the date he would have written a report.
Right. Mm-hmm.
And would he have continued to follow your son over time, or would he have just done this one time?
No, he just did it one time.
And how did you get to Dr. Cohen's office? This seems to coincide with the time you were also being treated by Dr. Burzynski.
Yes. Paul was showing some signs of like precocious puberty, although technically by his age it wasn't really precocious, but so they said to go to an endocrinologist at the Cleveland Clinic, and the endocrinologist there would not see him unless Dr. Cohen, who was the like the brain neurosurgeon there, or neurologist, whatever he was, he said he had to get a report from him. He didn't want a report from Dr. Kennedy or Dr. Burzynski. He wanted it from this Dr. Cohen. So we went to them, and he needed his report to review.
Can we get the projector turned on? And the doctor, and how old was Paul in September of 1991?
In 91, he was born in 8/10.
He was 10, okay.
when?
And it was 9 months, so he was 10.
I'm going to put a document up here and let me know if you can't read this.
Excuse me, what is that?
I'm just asking, I'm just going to use it to refresh your recollection. I can show it to her if you don't want me to project it right.
Display a document, it's not evidence.
No, it's not an evidence. It's
Objection,
a
here's
witness. So I believe she can write it down.
It's not an evidence, we can show it.
I kind of approach the witness. I'm not going to be offering it, so I don't have a copy of this very I can just hand you that and ask you if you can identify it.
Yeah, I'm sure I wrote this. Is that what you?
Yeah, well, can you tell us what it is?
It's a letter I wrote. I don't even know to who. Who did I write this to?
Does it appear, I can only ask the questions, I can't answer them, but does it appear like something that you've written?
Oh, yeah.
Okay. And do you see that is included in that is a document from Dr. Cohen, and you could take a few minutes if you need to look through it.
I don't even remember. Okay.
Do you don't recall, as you said
I
the other
honestly
day?
don't recall writing this, but I know this is our story, and it says I wrote it, so I believe I must have written it. Did I write it?
Okay, I believe so, but I can't testify. So if you can read through it and let me know if anything in there is inaccurate.
Okay. Can you
You
do
can take a
that?
copy of minutes if you need to.
Depends on where we going.
I've got one question, but I need her to be able to identify it and authenticate it first. Or you received a copy of it?
No, actually, I don't have this letter. I have the letter that he wrote to us saying to stay, whatever we were doing, to keep doing it, because he knew of nowhere that you could get results like that. Which,
And you testify that Dr. Cohen is someone who had reviewed all of your son's medical records, though.
I don't know about all the records. He had all of our scans up down his hallway, yes.
And I just, do you recall Dr. Cohen stating in that letter?
Objection, hearsay, whatever Dr.
She
Cohen.
said she received the letter
That-
from a doctor.
Objection, hearsay.
I can respond.
Yes, you can respond.
We've had a lot of testimony. This is a statement for treatment or diagnosis. We've had a lot of statements about what doctors told Ms. Michaels and what they've told other witnesses. This would fall in that same category. It would be a statement for treatment or diagnosis.
She hasn't testified that she received that letter. In fact, she's
She
testified.
testified that she did not receive that letter. So unless you're going to have something that she can testify that she actually received, then she can't testify about it. So far, our objection is sustained.
Let me back up. So this here, you testified that this document that you're holding in your hand appears to be something that you wrote.
this one, but this one that says Dear Jeffrey, that one, Dr. Cohen's name is Bruce.
I understand that, but what I'm asking is that entire document includes a copy of the letter pasted into it. Is that accurate?
Objection, those appear to be two different documents, not one entire
Yeah,
document.
you've got it really confused, Mr. Collins.
I don't think it's confusing at all. If I can just show the
You have
document.
given her a letter that she has identified. You have given her a letter that says that she doesn't know what it is. So what is it you're asking?
It's I can just ask the question, but it's not it's all one document. The letter is pasted into the document, so it's not a letter separate.
I
from the
don't know
document.
that, Mr. Collins. Well, look, you're telling me that, but it's not in evidence, and there's no basis to show that it's all in
I
one
don't.
document.
That's what I.
It was all given to her in one document.
That's what I was asking her during objection, so she didn't answer the question. So I guess I'm responding to the objection.
Okay, so what is the question, Mr.
The question is that letter and the document that I gave you, is that something that's
The letter from which
from Dr. Cohen?
Mhm.
Is that something that's pasted into the document that you're holding in your hand? Does all that appear to be from one source?
I have no idea if it's from one or not. I don't think I've ever seen this letter. I have a letter that came from Dr. Cohen to me, but it didn't say Dear Jeffrey. I mean,
Okay, and that's okay. I get to ask the question, you get to give the answers, and if your answer is you don't recall, you don't recall. So I'll take it back. We're not going to be offering it in evidence anyway, and let me just ask you a different question.
okay,
Thank you.
sorry.
That's okay. It's not your answers, they're your answers, so I apologize. Do you recall Dr. Cohen in any communication to you, in this letter or any other letter, telling you that the biopsy results showed that your son had a grade 1 astrocytoma and that radiation was recommended as treatment? Do you
Objection,
recall?
No.
excuse me, objection to the form of the question because it assumes her referring to or including in her response a document she's never received, which is hearsay to her.
I'm asking her if she recalls being told that in
Overruled. You can answer.
In the letter that Dr. Cohen sent to me, he said that we should keep doing what we were doing.
No, that wasn't the question. The
what-
question was,
She did say no.
oh, she said no. I didn't hear the no because I was
objecting, but
first
she
with
did say
Mr. Cogburn.
I got the no.
Okay, you got the no. Okay.
Okay.
So the answer was no.
The answer is no, you don't recall. Is that-
I don't recall what. That-
Now I'm confused.
I recall what Dr. Cohen said to us was to continue treatment that we were doing, which was anti-neoplastins, because he had never seen results like that with anyone else with that tumor. I do not recall him ever saying to do anything different, which radiation would have been something different, and he did not tell us that.
Okay, and that was about the radiation, so I should have broken my question down into two parts. So the first part of the question is, do you recall Dr. Cohen ever communicating to you that the diagnosis of the tumor was a grade 1 astrocytoma?
He concurred with what Dr. Kennedy had told us at Royal Oak Beaumont after the surgery, yes.
Okay. Okay, let me ask you. You actually covered quite a bit of my questions on your direct exam, so and you don't recall Dr. Cohen talking about the radiation, but I believe you said at the time Dr. Kennedy diagnosed your son that radiation was one of the treatment recommendations that was made and that you rejected that recommendation.
It was the only treatment recommendation that was made.
And that was in 1988.
That would have been, no, that would have been in 1985.
In 1985, around the time of the surgery.
The
biopsy.
surgery was in November, and then I remember when they first said to get radiation, we wanted to do it right away, and Christmas was coming up, and they said, no, go home and enjoy Christmas, this can wait. And we were glad that we did, because that gave us time to talk to other doctors, and Paul was already marked. They put the marks on him and everything for the radiation. It was going to start right January 2nd. He was going to go in. And then in the meantime, somehow, I think Kenny called his friend, whatever happened, he said, get some other opinions. And we called some other radiologists. And then we just thought there's really not much to be gained. And then they agreed there really isn't much to be gained. So.
And your knowledge of what the standard treatment for your son's condition in 1988 would have come from the professionals that gave you those opinions, sorry, 1985, would have come from the doctors and professionals that told you what your options were, right?
Yes.
And not from your own independent knowledge of how to treat cancer.
Oh, no.
And do you know if those treatment options have changed from 1988 to 2013?
2013?
Through today, but in this case we're dealing with through 2013. That's why I asked it that way.
I don't know if they changed any way that they treat it, but I know they don't cure it.
Do you know if Dr. Burzynski is able to cure this type of cancer for what percentage of patients?
I don't know.
And do you know what the cure rate or the remission rate is for either a grade 1 astrocytoma or the tumor that you've identified with standard treatment, including radiation and maybe chemotherapy in 2010 through 2013?
I don't know.
Do you know whether there are patients who've gone to Dr. Burzynski's clinic who have had a different experience in terms of their loved ones were not cured by cancer?
Yes.
And their experiences and their knowledge of the standard treatment and Dr. Burzynski's treatment would also come from professionals and physicians as well. Right?
Objection, conjecture, speculation as to what other folks would know.
Are you aware of patients who've gone to Dr. Burzynski's clinic who have had, are you aware personally of any patients who've gone who've had concerns about or have had side effects from antineoplastic treatment?
No.
Do you have any expertise or knowledge in the field of how a clinical trial or what rules apply to clinical trials?
No.
And do you know if your son was part of a clinical trial?
Yes.
He was?
He was.
But do you know what rules applied or who sponsored that clinical trial?
I don't.
And I asked you about, I think I already asked you this, let me just make sure. Do you have any personal knowledge of how many individuals with your son's type of cancer have been gone into remission as a result of antineoplastins and the period of 2009 to 2013?
How many patients have gone into remission who are on antineoplastins?
Yes.
I know other patients. We've become friends over the years who...
I guess what I'm asking, and I don't know how you would know, but I've got to ask the questions.
Okay.
How many people have gone to the clinic, enrolled in a clinical trial, and had a favorable outcome versus an unfavorable outcome? Do you have any way of knowing?
Objection.
I don't even...
Conjecture, speculation. I'm probably the one.
He asked if he had any way of knowing, to say yes or no.
I don't.
And you don't know how many people with a particular type of cancer, a particular type of brain tumor, who choose to get traditional treatment with radiation or chemotherapy and surgery, how many are diagnosed with that in a year, and how many of those, and how many years after treatment they survive? Would you have any way of knowing any of that?
I know of people who got traditional treatment, but I don't know of any who are still alive.
And that would be based on your personal experience and people.
Yeah, just
you've
my
met.
personal people that you know and people who talk about their family members and that.
And you're not, I think you testified you're, I know you're not familiar with what rules apply to clinical trials. I've already asked you that. Are you aware that rules do apply to clinical trials?
Yes.
Are you aware that a medication in a clinical trial, are you aware of why clinical trials are conducted on new medications that are not yet part of the standard treatment? Are you aware of why?
I'm aware of the theory of why they should be, but I don't know why they really, I don't know if that's actually what they do.
And are you aware that those rules and those standards would compare the new proposed treatment to existing treatments and follow those and track those over time from one patient to another? Are you aware that that's how that works?
I may have read that or heard that at one time or another, yeah. I can't say from my own.
Have you read the board's complaint in this case?
No, I'm embarrassed to say no, but no, I haven't.
That's okay. Are you familiar, the patients in the complaint are identified not by their names, but have you learned who they are from any source? If any of their family members contacted you, or you have any way of knowing what patients are included in the board's complaint?
No, I don't know.
And you've never worked at the clinic?
No,
So you wouldn't have observed any interactions between anybody at the clinic with the patients and the board staff's complaint?
I would not.
And you wouldn't know how the unlicensed individuals would have introduced themselves to those people or explained their roles in the clinic because you weren't there, right?
I didn't even follow the question. The unlicensed individuals.
All I'm saying is, well, you were asked a question by Mr. Cogdill about, and I think you called her Dr. Eva and Dr. Barbara.
Mm-hmm.
Dr. Eva and Dr. Barbara, do you know if they're licensed to practice medicine in the state of Texas?
I don't know. I know that they are licensed in Poland and they are not licensed here.
And so in your testimony was that in this conversation back in 1988, Dr. Eva, you gave very specific testimony that she told you she was a doctor in Poland and not licensed in the United States, right?
Yes.
But you don't, for the patients and the staff's complaint, you weren't there, you don't know what they were told or who told them what. Is that a fair statement?
No, I wasn't with them.
And do you know what the outcomes of any of the patients and staff's complaint, what their outcomes were after treatment at the Burzynski Clinic?
No.
Do you know how many of them are still alive?
No.
Although she's already said she doesn't know who they are, somehow would she know what their status is?
That's a fair point, Jay. Do you know if Dr. Burzynski has published anything related to the results that your son had at his clinic?
No.
Is that no, you don't know, or no, he hasn't?
I think he may have, but it's nothing I would read. Let's put it that way.
Ms. Michaels, I appreciate your answering my questions, and I'm passing this.
Nothing further.
All right, thank you, Michael. May this witness be excused?
Yes, sir.
Thank you.
Where are we, gentlemen?
We've got one more patient.
There's one location, we're going to
And, okay. You weren't hungry, were you?
Oh, I just had a candy bar.
No. When I say you're excused, you're excused. Why? Why anybody want
10 minutes. 10 minutes. 10 minutes. Good.